Welcome back to Research Recap, domestic violence related to crisis, trauma, and loss. This video is going to be talking about treatment planning and knowledge of conceptualizing crisis, trauma, and loss related to domestic violence. The theory that we're going to be using is trauma-informed care. If you are a counselor, please use this in your counseling. If you are just anybody in working with people who experience domestic violence, please consider using trauma-informed care. It is so useful for you as the counselor. It is also useful for you as the for people who are the victim. So to describe trauma-informed care, to give you a little bit of insight why it's so amazing and you should use it, and yeah. It focuses on re-victimizing, so that is interesting in domestic violence, right? Why would I want a focus on re-victimizing when people are re-victimized all the time in domestic violence? Well, I'll tell you. So this is going to be focusing on noticing that people are going to be re-victimized, but how do you empower while they do that? Well, this happens to them. It is just normal, and it's going to happen to them. It appreciates problem behaviors as attempts to cope. So it's not about this person's a problematic person or your behavior is a problematic behavior. It's noticing that you have you need to cope. And that is the only way sometimes, is having those problematic behaviors. And they're not bad. It is your survival mode. It maximizes the choice, which is so empowering to anybody in counseling, and that is obviously going to be had in counseling. Of getting your own choices in, having your voice heard, and understanding that you're in control of the counseling, which brings back your power in so many other areas outside of counseling, including in relationships. Seeks to be culturally competent. Of course, we see domestic violence across all cultures, regardless of socioeconomic, of substance abuse, of of cultures. So, but still understanding that there are different aspects to understand. And it understands each survivor in their own experience. So between people, different clients who've experienced domestic violence, or between your experience with domestic violence or the client, understanding that their own experience is their own. And so they might experience something that is a crisis that is may not be seen as a crisis from your own, and that doesn't matter. Go to the next part for the clinical impacts, client needs, description of effective ways to address client crisis, trauma, and loss, and then 3 main goals of the client's needs. So tune in for the next part.